So the esophagus is approximately 25 to 30 centimeter long. It starts at C6 vertebra at the level of pharynx and ends at T11 vertebra, and they join the cordia of the stomach. So the cervical esophagus initially is present in the midline. Then it deviates slightly to the left of the trachea as it passes through the neck into the level of thoracic inlet at the level of carina, so as to accommodate the arc of aorta which turns towards left. The esophagus deviates towards the right. This is a very important anatomical landmark at the level of T4 vertebra. Then it winds around the left mainstem bronchus and deviated to the left as it enters the diaphragm. In the neck and upper thorax, the esophagus is in between the trachea and the vertebra, whereas in the chest, the heart and precordium, which lies anteriorly to the esophagus and posteriorly bounded by the descending thoracic aorta, where it through the diaphragm the aorta and the esophagus is separated by the median arcuate ligament. With respect to the layers of the esophagus does not have a serosa. It has mucosa, submucosa, muscularis propria, and periesophageal tissue adventitia. In mucosa, it is divided into epithelium, basement membrane, lamina propria, and muscularis mucosa. A very important point here is esophagus epithelial lining is squamous, where it is going at the level of gastroesophageal junction. There is a transition from the squamous epithelium to the columnar epithelium, and this transition, squamo-columnar junction, is known as Z-line. A very important anatomical landmark: how to identify gastroesophageal junction. Two anatomical and two endoscopic. So with respect to this, endoscopic anatomical landmarks, what are they? One is the squamo-columnar junction, which is nothing but Z-line, where the squamous epithelium transition to a columnar epithelium. Another point is the distal mucosal folds, which is in the lining of the esophagus, which is very smooth in nature, transition to the rugal folds of the stomach, and this is a very important gastroesophageal junction marker. Another point is externally called as the collar of Helvetius. So what do you mean by collar of Helvetius is the circular muscle fibers of esophagus which join the oblique fibers of the stomach and the gastroesophageal fat pad. So these are consistent identifiers of gastroesophageal junction. With respect to the blood supply, a very important transition: cervical esophagus, thoracic esophagus, abdominal esophagus. Cervical esophagus derives its blood supply from inferior thyroid artery, which is a branch of a thyrocervical trunk, and also from the subclavian artery, whereas thoracic esophagus derives direct branch from the aorta. Esophageal branches from direct branches from the aorta, also from the right bronchial artery, and also from the intercostal arteries, whereas abdominal esophagus derives branches from left gastric artery and pad phrenic arteries. With respect to the venous drainage, submucosal venous plexus, they will drain again at 3 levels. Cervical esophagus is drained by inferior thyroid vein into the internal jugular vein and subclavian vein, whereas in thoracic esophagus, intercostal veins, esophagus vein on the right side and hemiesophagus vein on the left side drains. It's a venous drainage for thoracic esophagus, and for abdominal esophagus, it will be drained by a two important portosystemic circulation. In portal circulation, left gastric vein and short gastric veins, whereas in systemic circulation it is paired phrenic veins. So which is depicted in this diagram. The abdominal esophagus is drained by the left gastric vein, which drains into the portal vein, and also by the short gastric vein, which drains into the portal vein. Systemic circulation is mainly by the phrenic vein. So a very important anatomical landmark is esophagus muscular lining. It is inner circular and outer longitudinal group of muscles. It has mainly three important constrictions, and what are they? The cricopharyngeus muscle at the level of C6 is the narrowest point of gastrointestinal tract, marks the superiormost portion of hourglass shaped esophagus, upper esophageal sphincter, and just below the carina, where the left mainstem bronchus at the level of T4 vertebra and aorta abut the esophagus. This is called as a broncho-aortic constriction, which lies at the level of T4 vertebra that create the center narrowing. Finally, the diaphragmatic constriction, which measures 16 to 19 mm, mark the inferior portion of the hourglass, located where the esophagus passes through the diaphragm. So between the layers of the esophageal musculature lies the interconnected network of ganglia, which is known as Auerbach nerve plexus. So another very important point is lymphatics. The cervical esophagus, which mainly drains into the deep cervical lymph nodes or internal jugular lymph nodes, whereas and also to the paratracheal lymph nodes. In case of thoracic, it drains into tracheobronchial lymph nodes, mediastinal group of lymph nodes, and in case of an abdominal esophagus, which mainly drains into retrocardiac and diaphragmatic nodes and left gastric nodes. As we discussed, the sympathetic chain, which thoracic sympathetic ganglion, they all connect to form Auerbach nerve plexus, which lies between the muscular layers of the esophagus. So this is a very important Achilles triangle, a zone of sparse muscle fibers. So there are two important triangles. One is Killian's triangle and Limas triangle. So here the very important point, the transition point between the oblique fibers of thyropharyngeus muscle and the horizontal fibers of the cricopharyngeus muscle. This transition marks Killian's triangle, and in this area of dehiscence, because of increased pressure, there occurs a Zenker's diverticulum. What is Limas triangle? The exposed circular muscle fibers of esophagus where the outer longitudinal muscle fibers are deficient. This was called as Limas triangle. So just remember this value. A very important point is the lower esophageal sphincter The resting pressure is 6 to 26 millimeters of mercury, whereas upper esophageal sphincter resting pressure is 60 millimeters of mercury, which is of 10 times of the lower esophageal sphincter. The esophageal body contractions amplitude is 40 to 80 millimeters of mercury and duration is 2.3 to 3.6 seconds.